29 million women in America suffer from pelvic and bladder pain, chronic. It's hard to diagnose, hard to treat. A urogynecologist who practiced in the Quad Cities for many years is here to explain right now a new therapy that is on its way to the market. He is Dr. Nolan Hetz, MD, the CEO and founder of GlobaLASEReach.
That's correct.
And this device that's going to deliver this therapy. I know you're very excited about it.
I'm very excited because there's no other energy or treatment source known to mankind that can do the multiple things that this photon energy can do if you can get it to the tissues that are diseased and are causing pain.
Well, May happens to be Chronic
Pelvic Pain Awareness Month.
Awareness Month, which affects, well, 29 million women in America. And this is something, I mean, I'm sure you tried to treat in your practice for many, many years.
4 years, and tried and done everything. And most procedures, almost all procedures available, are invasive. They're painful to receive and are rare to have complete remission of symptoms. And this technology, early evidence has shown to put women in remission of their pain, including painful intercourse.
Well, what we want to emphasize here is that this is in the works. The device, the machine, I guess you would say, the photon energy, the high intensity. Well, we have a picture of it. Is that's approved? That's well, set up.
Yeah, this photon energy has been an evolving science for the last 30 years, and as more research is done, more things are being tried on it. Most of the time, it's been treated through the skin. But this technology is one of the first to actually administer the photon energy into the core of the pelvis through the vaginal, being a portal to those tissues.
And the point is to, a lot of this pain originates from inflammation.
Right.
From originating from where, doctor? Do we know?
For the most part, yes, and it's mostly more than one organ system. You know, 85 to 95% of all disease of mankind is inflammatory based. So a lot of pelvic pain originates from endometriosis, which are cells that get outside the uterus and cause inflammation of the tissues, and those trigger pain in other areas of the pelvis, like the pelvic muscles, the nerves.
The bladder's often involved too.
Right. The condition called interstitial cystitis is an inflammatory process of the bladder, and that can cause pain, but that you can treat the bladder, but the pain also is in the muscles and nerves of the pelvic floor, caused by the pain that originates from these primary organs like the bladder, like endometriosis or colitis. So many of these women have pelvic pain with sitting, standing, walking, during intercourse, doing nothing. They can sometimes experience spasms around their vaginal vault because the muscles are in spasm. It's very debilitating.
You told me you have known many silent sufferers.
Right.
People who don't even know to go to the doctor because they don't know where to begin with it.
Well, there's a stigma with pelvic pain and painful intercourse, and that's been perpetuated by the community, us physicians. Women coming in with pelvic pain, it must be in their head because we can't find the source and there's no way to treat it. You can't find the source.
See, that's what's so frustrating. I feel that happens a lot with us. You know, you can tell a doctor a symptom, and then you work up a million tests on us and scans, and they say there's nothing wrong.
Right. But now the understanding in the last 10 years that chronic pelvic pain doesn't come from one organ. We're dealing with the bladder frequently, or the colon frequently, endometriosis, and then those conditions cause pain to set in and spasms set in the muscle hammocks of the pelvis, and also trigger constant nerve impulses that the pain continues.
So for this therapy, it is a high intensity photon energy, which is a kind of heat? How would you describe to us in layman's terms what the photon energy is?
Photon energy is strictly waves of energy that are invisible, that when it hits the surface of the skin or the vaginal walls, because the waves are not together, they're spread, they continue to travel through the skin surface or the vaginal mucosa tissue surfaces.
And heal.
and trigger things in cells. It triggers, suppresses the inflammation of the tissues that are inflamed. It stops nerve impulses immediately if you can get enough energy, that's why it's high intensity, to those tissues and nerves that are in spasm. It also opens blood vessels to bring more blood. It also opens lymphatic channels to drain the swelling in those tissues that women don't even know they have. Men get this condition also. But it also, the energy triggers cellular energy to be developed in the mitochondria that's required for the tissues to heal. So inflamed tissues can't heal unless you suppress the inflammation.
So it's not just a painkiller. It's also healing the inflammation, which then removes the pain.
You're treating the underlying problem in the bladder, the pelvis, and you're also treating the secondary causes of pain that originate in the pelvic floor, muscles, the nerves, the base of the bladder, tissues that you can't surgically remove, because you try to remove the pelvic muscles or nerves, everything will fall out. So the treatments are painful.
Well, this new therapy, the Resolux, not painful at all. And here's the thing, we have to watch this. No, the reason we're putting this on is that a local doctor really developed this. And this is technology that is the technology's there. Right. The clinical trials on human people will be coming up in these next couple of years, so this is a ways out. But if you go onto that site, you can keep track of it. The doctor and all of his other clinical workers will be keeping us all up to date on that. Dr. Hetz, I know that this affects a lot of people, and I'm glad that you were here to talk about it today, to know there's hope on the horizon, for sure.
It is really hope. I'm here to make pelvic pain aware, because this is Pelvic Pain Awareness Month. I'm also here to give hope to those 1.1 to 1.5 billion women out there with chronic pelvic and bladder pain. We're not talking millions. There's 29 million American women, but there's over 1 billion women who are suffering, and are suffering in silence. And a large portion of these women, these treatments don't work. They'll go on chronic opioid therapy in order to survive. So thank you for having me on.
Thank you, Dr. Hetz.
This is hope for those sufferers.
Welcome back to your Quad City area.
It's great to be here.
Thank you, sir.